Hey, how's it going? Today I'm talking about knee discomfort when you increase mileage and what to do.
This is Running to the Castle, a podcast for injury-prone runDisney runners on a journey to running magical miles. Join me, Dr. Allie, as I share the secrets I've gathered as a runner, doctor of physical therapy, and coach. You'll learn the exact ways I get my clients to the castle strong without feeling broken or held together with KT tape as they cross the finish line.
So I saw a post on Facebook a couple of weeks ago, and somebody said, extended my running miles from 6 miles to 8, and I have some knee discomfort. What can I do besides ice? And if you've been listening for any length of time, you've probably already noticed the problem. But if you're new here, welcome. Hi, I'm Dr. Allie. I have a background in physical therapy. I am a runDisney running coach, specifically for slow, back-of-the-pack runners or injury-prone or injury-averse runners. So when I see questions like this on Facebook, I immediately think, oh my God, what is the recommendation going to be? From the peanut gallery, for lack of better term. So I immediately go to the comments. So here are the comments. Might be time for new shoes? Question mark. Strength training! Exclamation point, exclamation point, exclamation point. Compression socks after a run. Strength training! Exclamation point, exclamation point, exclamation point. Hydration! Foam roll. Oh, and strength training. That's all from one person. Knee brace. Anti-inflammatory, ice, rest. Next person, take a rest day. How long have you been running for in general? Where on your knee is the pain? Knee strengthening exercises. I've been doing strengthening and mobility for my right knee. Everyone is different, but for me, my knee doesn't track correctly. For PT, I have various exercises. You can try squats and lunges and see if your knee goes straight up and down or if it feels wobbly or wants to bend inward. You can also do step-ups to strengthen your knee. Also, using a resistance band around your thighs can help strengthen. Help strengthen what? This next person, tequila is very medicinal. Also, rest, ice, topical Voltaren, anti-inflammatory cream, scent-free Aspir cream with lidocaine, Tylenol, Motrin, compression sleeve, Elevate. Foam roll your IT band. Strengthen your hips. Almost all running injuries stem from weak hips. Bad form from weak hips. Misaligned foot strike from poor mobility and weak hips. Are you strength training? I'm going mad right now recovering from an overuse knee injury, learning the hard way. Strength train and mobility. Strength train your glutes, quads, calves. They're weak. Depends. What's causing the discomfort? Have you had scans? What exercises has the physio already given? Rest up for a few days, then try and run again. If it's still problematic, go and see a physio for a diagnosis. There's so many things it could be. Don't go buying any knee braces or patella straps until you know what you're dealing with. That's 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16. 16 responses. And I started thinking to myself, none of that's going to work. And then finally, somebody says, that's actually a big jump. 10% max increase per week to build up slowly and avoid injury. Thank God somebody else said it. However, that doesn't help the fact that this person already has the pain now. It will help prevent it in the future. It could have helped prevent it had they known it in the past, but coulda, shoulda, woulda. You can't change the past. She has it now. So what should she do? So ice is wonderful. Ice helps inflammation for sure, and it helps pain. The number one mistake that runners make when it comes to using ice for pain relief is they think it's going to be Advil. They think it's going to be Aleve, where those are also anti-inflammatories and pain relief, but they work systemically. They work in the body. So anti-inflammatory medications like Advil, Aleve, Motrin, they target things like prostaglandins, yes, that's a fun word, at the site of the injury. Those prostaglandins are part of the inflammatory reaction. When you get hurt, your body has a reaction. Histamine is released, the mast cells release histamine, and a whole cascade of events happen. Anti-inflammatories work at the site to slow that problem down. And they also work for pain relief. And they work by going through the blood system. So they work deeper than ice. Ice does work, but it only goes so deep. So if you are a large person, if you have a large body part, whether it's because you're overweight or that's just the way your body is made, it's going to take more oomph to get ice to go down the layers. You're going to need to use it for longer. You're going to need different types of ice, literally different types of ice. Is it just a bag of ice cubes? Is it a bag of ice cubes in water? Is it a gel pack? Are you submerged in an ice bath? These are different things, okay? And I started to say the number one mistake that runners make is thinking that ice is Advil. So obviously, I know they don't think it's Advil. They are different things, but they think it's going to work as fast as Advil does. It doesn't. Knee discomfort from running could be handled with ice alone. Could. Depends on the severity of the problem, the severity of the injury, for lack of term. We're not always injured when you have this kind of discomfort. But when you first have this discomfort, you need to be icing for 20 minutes at a time, 5 times a day, for 10 days, or up to 14 days. Most people slap some ice on it. It helps for a little bit of time, and then it comes back. Because what happens is the ice helps calm down that inflammatory reaction, helps calm down that cascade of events that's happened, but it only works for about 30 minutes. The 20 minutes it's on, and maybe 10, maybe 20 minutes after it comes off. So that's why it feels good for a temporary amount of time, but it always comes back. So then you need to put the ice on it again, because what can happen is if you have an inflammatory reaction going on, you can use ice to bring that inflammatory reaction sub-threshold, meaning it lowers it down so your brain doesn't recognize the pain. The inflammatory reaction is lower than visual swelling. That ice can help bring that down. But it only brings it down so much. So then it starts creeping back up again as soon as that inflammatory reaction can keep going, right? And so then it goes above threshold again. So you put ice on it, it brings it sub-threshold. But what happens if you keep putting that ice on it to keep bringing it down and down and down? Well, if you're regularly putting that ice on it, it may get just above threshold, or maybe it stays sub-threshold, and then you put the ice on it again, and it goes even lower and lower and lower and lower. And that's why you need to do it 5 times a day, sometimes more, but I'd say 5 times a day is most common for 10 to 14 days. That's a long time. I bet you are sitting there listening or running, listening, and you're like, oh my God, Allie, that's so much. It is. And that's why people tend to go toward things like Advil or Aleve more often, because you can take it and it will last 8 hours. And you don't have to be stuck on the couch for 20 minutes 5 times a day. You can just pop a couple of Advil. Now, I'm not saying go do that. That is outside my scope of practice, be able to tell you which one to use, but I can tell you what each of them does, and you get to use your own judgment based on your history, what works for you, what you've talked to your doctor about. But do that. So yes, use the ice, use it more. Other things this person could be doing is foam rolling. Is it their IT band that's sore? Well, if it's just sore, maybe we need a little massage. So foam roll, massage gun, professional massage. Maybe ice isn't working for them. Maybe ice doesn't work very well for them. Maybe they need a hot Epsom salt bath. Maybe they need contrast. Maybe they need heat first and then ice. Again, 20 minutes at a time, 5 times a day. Not necessarily the hot Epsom salt bath, because you're submerged in it. It's going to last longer. You could do an ice bath. You're submerged in it. It's going to last longer. It's also colder, but it's also miserable. If you've been around for any length of time, I don't do well in the cold. I get cold urticaria. I break out in hives. That's what it is. So heat is my friend. Olaf likes warm hugs. Dr. Allie likes warm baths. But you may like ice. You may like ice baths. They do work. And the benefit of ice baths is they work so quickly, comparatively. You only need to be in it for 3 to 5 minutes. And you only need that body part in it. So if she could finagle herself to make it so that just her knee is in that would be wonderful for her. But all of these other things that these people are saying, like the strength training, please, 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 please do not use strength training to cure your pain. Strength training has a time and a place. And that's usually prevention and support. But when you have this pain, strength training isn't the thing that's going to get rid of your pain. Now, I'm not saying movement's not going to help the pain. So all these people who are saying you need a strength train to get rid of your pain, I would like to see what their rehab looked like, right? Like if you've ever gone to the physical therapy clinic, most people are like, okay, well, I go for my massage and I go for my strength training. But what else is happening? They warm you up on the bike. They warm you up with a heating pad. They use ice. They use stim. They use massage gun, foam roller. They do all of these other things before strength training. And also, things that look like strength training in the beginning are movement, just to improve blood flow, to improve circulation, to help facilitate the natural inflammatory process that should be happening, but can go stagnant, right? Like if you have a sore knee and you don't know what to do, you're probably going to lay around and not do anything. Well, if that knee is also swollen, your knee's going to hurt every time you get up. And so then that's going to give you feedback that I shouldn't get up. I should just be laying around. But in fact, the laying around is what's making it worse. So in physical therapy in the beginning, we do some gentle movements. We do some gentle stretches. We do some heel slides. We do some quad sets. We do some knee bends. We straighten out the leg to a tolerable amount without weight to get blood flow, to improve the circulation, to get things moving, to then get that swelling out so then it doesn't hurt every time you get up and move around. Right? Like the best example I can give is when I was in college, I hurt my thumb, I tore a ligament, and it wasn't great. So I tore it in November. I ended up having surgery the following June, but I tried rehabbing it for pretty much that whole amount of time in between. And the thing that was crazy was that my thumb hurt the most when I walked. Like the doctor, the PT, the OT, they were like, well, what are you doing? Walking on your hands? I'm like, well, no. But that's what hurt because of how it was swollen and how it was torn. Every time I took a step, the swelling shifted and put pressure on these different nerve fibers, and it caused pain. It wasn't excruciating pain after the first 2 weeks, but that's when it hurt. And that's what prompted me to actually end up getting surgery. And in surgery, they found that the capsule that goes around the bones that keeps everything together and one of the tendons were flipped. They were torn and flipped, and they were stuck in between my thumb bone, like where the finger bone is and where it connects to the rest of my hand. It was flipped, and every time I took a step, in addition to the swelling shifting around, it put pressure there. So that's a story just to say, like with swelling, when you go to move, if you still have all of this swelling, well, it's taking up all of this space that normally is potential space, meaning there's room for swelling to happen, room for fluid to be there, but it's not supposed to be there. And so there's this potential space where you're just, putting pressure on things that normally don't have the pressure on them, putting fluid in places that normally don't have the fluid, and that causes more pain. So strength exercises in that moment, not going to help. If somebody notices that strength exercises, quote unquote, strength exercises are helping, it's more likely the other things that are also happening and the gentle movement, getting that body moving again, that are actually doing the pain relief right then. Do not take this to say that strength exercises aren't important. They are absolutely important. And if you know me, I don't like strength training. Like, it's low on the totem pole for me, but I do the bare minimum, and I know the amount people need to be doing to be active, to be able to run injury-free, pain-free, everything like that. So please don't take this as, oh, Allie just hates strength training. Yeah, it's not my favorite. I'd rather just go run and I'd rather go stretch. But it's important, and I know the mechanics behind it. I'm a physical therapist. Like, I get it. Just not my favorite. Use it in the correct manner to maximize your recovery. And go back and do the ice more often. I would bet $100 that this person did ice once or once a day, and they just aren't at a therapeutic level. Probably helped a little bit. Doing more in this instance in the beginning will help more. Now, if you're outside that 2-week window, doing it more often may not help. There is a fine line. That's why you do it from the get-go. Or that's why you get a coach or go see a physical therapist and find out from them what you need to be doing. Don't take advice from the peanut gallery on Facebook, because all of them are saying to strength train. Strength train with the elastic bands around your knees. What are you strength training with that? Could you be strength training your glutes? Absolutely. Absolutely you could be. But doing what exercise? Just Googling an exercise. Well, I could sit here with an elastic band around my knees and it won't do anything. It needs to be purposeful, and it won't get rid of the knee pain. Use that strength training elsewhere. Please take what you've learned in this episode and use it to adjust your strategy for your RunDisney race training. It's not about doing more. It's about doing the right things in the right balance so you can finish strong, not broken. And if you want personalized guidance specific to your race, your injury history, your running background, and your goals, that's exactly what we do inside Stronger, Faster, Finisher. You'll get step-by-step instructions and a proven system to help you train smarter from start to finish. Join the waitlist today to be the first to know when it opens next. That's all for now. Talk to you soon.